Welcome to another video. In this video, we will continue learning maternity nursing starting with GTPAL and prenatal care. Pregnancy outcome terms to know. Gravida refers to a pregnant woman. Gravidity refers to the number of pregnancies. A nulla gravida is a woman who has never been pregnant. A prima gravida is a woman who is pregnant for the first time. A multigravida is a woman in at least her second. Parity is the number of births carried past 20 weeks of gestation, whether or not the fetus was born alive. A nullipara is a woman who has not had a birth at more than 20 weeks of gestation. GTPAL is a 5-digit system. This is a must-know for the NCLEX. It's important to know what each letter means. Let's start with G. G means gravidity, which is the number of pregnancies, including the current pregnancy. T means terms births, which is considered 38 weeks or more. P means preterm births, which is considered anywhere from 20 weeks up to 37 completed weeks. A means abortion or miscarriages prior to viability. L means living children. Let's do a practice question. Jane is pregnant for the third time. She had twins at 36 weeks and a son at 38 weeks gestation. G is 3 because this is a number of her pregnancies. T is 1 because she had only one child at term, which is 38 weeks. P is 1 because she had one preterm baby at 36 weeks. A is 0 because she had no abortions. L is 3, she has 2 living twins plus a son. How did you do? Let's continue on with the lesson. Prenatal care includes many parts starting with an initial exam. Initial exam includes the following: psychosocial assessment, complete history, including medication, personal history from partner, family history of genetic problems, complete physical, baseline laboratory values, which include CBC, blood type and RH, urine analysis, and STI screening. Important STI screening will include HIV, rubella titer, and hepatitis B. Nutritional counseling is also part of the initial exam. Here are the most important points to remember about nutritional counseling. The average expected weight gain during pregnancy is 25 to 35 pounds for women with a normal pre-pregnancy weight. An increase of about 300 calories per day is needed during pregnancy. Calorie needs are greater in the last 2 trimesters than in the first. An increase of about 500 calories per day is needed during lactation. A diet high in folic acid or folic acid supplements is necessary for all women of childbearing age to prevent neural tube defects and orofacial clefts in the fetus. At least 8 to 10 8-ounce glasses of fluid are needed each day, of which 4 to 6 glasses should be water. Sodium is not restricted unless specifically prescribed. The initial exam includes teaching the patient to avoid teratogens. Teratogens are an agent or factor which causes malformation of an embryo. Note that the fetus is especially vulnerable during first trimester. Teratogens include drugs such as category C and D medication such as warfarin, lithium, methimazole, phenytoin, tetracycline, and antipsychotics. Illegal drugs: cigarettes and alcohol. Smoking increases incidence of abortion, prematurity, and more. Quantity of alcohol may produce fetal effects such as central nervous system malformation and neurological problems. Teratogens also include thermal risks and radiation. Teach the patient to avoid hot tubs, long baths, or excessively hot showers. Infections such as Group B strep are also considered teratogens. Important nursing actions to consider for Group B strep are the following: culture obtained at 35 to 36 weeks. Treat positive culture with penicillin IV piggyback every 4 hours during labor. Monitor newborn for infection. The last type of teratogens you should be aware of is torch. The torch panel test is used to identify illnesses that potentially affect an unborn infant while pregnant. The abbreviation TORCH stands for the 5 infections that are covered in the screening. T for toxoplasmosis. O for other such as syphilis, varicella, parvovirus. R for rubella, which is also known as German measles. Maternal infection during the first 8 weeks of gestation carries the highest rate of fetal infection. C for cytomegalovirus. H for herpes infection. Because these illnesses can cause major issues during pregnancy, it's critical to detect them early in the process and treat them if feasible. The TORCH screening test is frequently administered at a woman's first prenatal appointment. Now let's go over initial and subsequent exams and what assessments are done during this time. Assessments include the following: weight, fundal height, fetal heart rate, fetal activity, urine check for glucose and protein. At 16 to 22 weeks, assessment includes screening for neural tube defects with maternal serum alpha fetoprotein. At 28 weeks, assessment includes the following: screening for diabetes mellitus, administering Rho-D immune globulin if Rh negative. Begin non-stress testing twice a week for any pregnancy at risk for intrauterine fetal death. At 35 weeks, assessment includes testing for Group B strep. Physiological changes in pregnancy are the result of hormone production and the enlarging uterus. You should be familiar with these changes for the NCLEX. Reproductive changes will include the uterus increasing in size, shape, position. Ovulation and menses cease. Cardiovascular changes will include increased cardiac output and blood volume, increased heart rate, increased coagulation. Physiological anemia occurs as the plasma increase exceeds the increase in production of red blood cells. Because of this, iron requirements are increased. Retention of sodium and water may occur. Respiratory changes include increased maternal oxygen needs. Uterine enlargement displaces diaphragm, causing increased respiratory rate and decreased total lung capacity. Shortness of breath may be experienced. Musculoskeletal changes include pelvic joint relaxation, body alterations require adjustment in posture, separation of rectus abdominis muscles. Gastrointestinal changes include nausea and vomiting, slow digestive processes, constipation. Nausea and vomiting may occur as a result of the secretion of human chorionic gonadotropin. It typically subsides by the 3rd month. Renal changes include increased glomerular filtration, urinary frequency. Endocrine metabolic changes include increased hormone production and increased thyroid and parathyroid activity, insulin resistance. Integumentary changes include hyperpigmentation causing chloasma, linea nigra, strain gravidarum, and palmar erythema. Changes in physical appearance may lead to a negative body image. The client may make statements of resentment toward the pregnancy and express anxiousness for the pregnancy to be over soon. Now let's learn about the expected vital signs. As a nurse, it's crucial to know when an assessment is normal or abnormal. Let's start with blood pressure. Blood pressure should be within the pre-pregnancy range during the first trimester. Decreases 5 to 10 during second trimester. Important to teach the patient, position affects blood pressure. Supine position may cause supine hypotensive syndrome or vena cava syndrome. Signs and symptoms include dizziness, lightheadedness, and pale, clammy skin. Interventions include placing the mother on her left lateral side, semi-Fowler's position, or place a wedge under one hip if supine. Pulse increases by 10 to 15 per minute around 20 weeks. Respirations increases by 1 to 2 per minute due to elevation of a diaphragm. Fetal heart tones. Normal baseline rate is 110 to 160 per minute. Accelerations are reassuring. This indicates intact fetal central nervous system. Well, that's it for this video. In the next video, we will continue the lesson by learning about complications of pregnancy. Thanks for watching.